Hi, I'm Dr. Rafi Romano. Today I'd like to present you a case that I've treated with clear aligners with a big space between the lower incisors, and the message in this case is not the treatment itself, but what was the etiology for these spaces. You can see here a case of an adult patient who has some spaces in between his lower two incisors. They are not only spaced but also inclined to the right and to the left, and the space between them is almost enough to get an extra two central incisors. And you can see that also the teeth are proclined out a lot, which means that we have here a big etiology of tongue thrust. Now you can see when we look at the patient, this is the panoramic x-ray. You can see because of the proclination, the roots of these two centrals look very, very small. Actually, they are not so small. It's only because the big proclination. And you can see here in this slide, he was treated by clear aligner. You can see here how it fits. You can see two attachments on these two centrals in order to upright the teeth. And slowly we are closing the space. Now, technically, it's not a problem to close a space. This is very easy. But there are two things we need to take into account when treating such patients in such a way. One, look at the tongue. The tongue is still there, still has the potential to take these teeth forward in the next few years. And even if you do a permanent splint at the end, it means that these teeth will have the constant tendency to move forward. Now, when there is a tendency to move forward and you tie them, the force goes somewhere. Sometimes to root resorption, sometimes to movement of the whole front segment forward. The tongue has a really big force that we have to take into account. The second is that by closing all this space, we enlarge the overjet. The overjet before was very minimal. Now when you close the space, we get a very big overjet. So regardless, the beautiful result and the periodontium, which is built quite nice. You remember before he had no papilla here, and now the papilla grew, and the midline is nice, but we get still the tongue and the overjet as our main problem now. So, of course, there is pros and cons in every treatment. I just wanted to point out for you this case as a potential risk for relapse in the future, which need to be monitored both by the orthodontist and the periodontist. Thank you very much, and I would be happy to see you in my next series of video. Bye-bye.